For centuries, malaria has plagued humanity, with Uganda bearing one of the highest burdens globally. The World Health Organization reports a staggering malaria incidence of 478 cases per 1,000 people in Uganda. Tragically, the disease claims around 16 lives daily.
At one time, a place like Apache district, had the highest number of infected mosquitoes in the world. A person could be bitten by 1,560 infected mosquito bites every year. So every mosquito bite in a patch was infectious. But good enough, the mosquitoes don't live for long.
Malaria's impact goes beyond health, causing 40% of school absenteeism and significant economic losses. Between 2020 and 2024, malaria fatalities surpassed 50,000, 10 times the deaths caused by COVID-19 during the same period.
The epidemiology of malaria has completely changed, and it baffles even us because we are seeing older children dying of malaria, children between 12 and 19 dying of malaria, and even adults.
Dialysis is sometimes caused by the kidney failure caused by the malaria. You've heard of people's hands being cut off because of the death of the tissue of the hands, the legs. You've heard of children getting cerebral malaria, severe anemia, and dying. The mentally sick people, some of them have had a malaria sequela at one time, which affected their brain. The poor performance at school.
Timely diagnosis and treatment remain major challenges. Resistance to first-line anti-malaria drugs has risen to 6%, and incomplete treatment exacerbates the problem.
There's a malaria overlay that stays in the liver for a very long time, and people may treat and treat and treat, and the treatment won't work. There's also a new type of malaria called malaria nulls that you may use your RDT, the ones that are common, and you miss the malaria. You won't detect it. So by the time people come to the hospital, sometimes it can be late. And also I want to say that there's a lot of self-medication that people start with. Let's take a paracetamol, let's take some antibiotics, let's take, maybe it's a bacterial infection.
Ugandans buy averagely 7 tablets out of 24. 1/3 of the treatment. The volume of low quality malaria supplies, according to researchers, is about 20% on the market. According to NDS findings, about 5%.
Now, some of these products that get stolen from government facilities, they go under concealment. Some of them, their quality is compromised because they are stored, they are being kept in the ceiling in high temperatures.
Evolving mosquito behavior complicates control measures. Mosquitoes now bite earlier in the evening, even outdoors. Climate change further worsens the situation, disrupting intervention timings.
Look at the amount of red, look at the amount of green. Where a water said there's breeding ground everywhere.
But now there is a current new mosquito called Anopheles stephanis, which has come into play right from the Turkana area, and it's around, it's still in Kenya, but we are watching out for it. That one can breed anywhere.
Uganda plans to roll out the R21 malaria vaccine in April 2025, targeting children.
The vaccine is only given to children. It is not for adults. It reduces severe malaria. It also reduces hospitalization.
The vaccine, funded by Gavi and the Uganda government, will be distributed free of charge. Health experts emphasize the need for collective action. Integrated strategies, including indoor spraying, use of insecticide-treated nets, and timely medical care, are crucial.
They've tried to implement the strategies which are recommended globally. But unfortunately here sometimes, as recently as last year, we wanted to spray one of the districts in this country. They refused. They demonized it, they politicized it, they did everything. And the district, this is Chibuku, it wasn't sprayed, and 80% of all the deaths and blood transfusions were children from Kibuku at Mbari Regional Referral because they refused.
Today, it's common knowledge that we are seeing more and more of these children with malaria acute kidney injury. So when they come in, it's important that we first of all hydrate them, make sure we put them on the correct anti-malarials. If they are developing acute kidney injury, we may have to switch them to the second line of treatment for severe malaria.
The antimalarials we have, there is no another class of medicine. We have only the artemisinin-based medicines. They are developing resistance because of the way we use and misuse them. Okay? So this time they are already weak. So we need to complete treatment. We need to take a full dose. We need to prolong the viability of these medicines. Alternative medicines are going to be available at least 3 years from now.
Uganda's fight against malaria is far from over, but with sustained efforts, innovation and community cooperation, victory is possible. The planned vaccine rollout in April offers renewed hope in reducing malaria's grip on the nation. Mwesigye, NTV.